Diabetic ketoacidosis is an acute complication of diabetes mellitus. It usually occurs in the cases with severe insulin deficiency. When there is no insulin in the body, the glucose present in the bloodstream cannot be used for the energy purposes of the cells, right? So in those cases, when there is either absolute deficiency or very severe resistance to the use of insulin for uptake of glucose into the cells, in such cases, the hyperglycemia will occur and the body will not be able to use sugar for energy purposes. So cells need energy for their everyday work. Where is the energy going to come from? In such cases, adipose tissue which is present in the body, that is the fatty tissue, it is used for energy purposes. That fat is stored in the form of triglycerides and these will be broken down into free fatty acids and glycerol. Further, this lipolysis is followed by the oxygenation of some of the fatty acids which are present by the liver. The liver is going to oxidize the free fatty acids, some of the free fatty acids, into ketones. These ketones are acidic in nature. These ketone molecules are acidic. So, when they keep on accumulating inside the bloodstream, they will lead to decreased pH of the blood, which is acidosis. Now, it's not like this ketogenesis is something new to the body. It happens every day in your body, right? And most commonly, it occurs when you are on fasting, right? Someone fasts for the religious purposes. They don't eat anything, right? Then the fat is used for energy purposes. But what makes this ketogenesis significant is that in this case, there is too less insulin, or just say absolute lack of insulin. So when there is no insulin, ultimately all the energy which is going to come to the cells is going through the fatty tissues, right? There's no sugar to be used. There's enough sugar in the bloodstream, but no insulin to help that sugar get uptaken by the cells. Once the rate of formation of ketones exceeds the rate at which these can be used by muscles and other body tissues, or say can be excreted out by the kidneys, and it keeps on accumulating inside the body, then it will lead to metabolic acidosis, which is a harmful condition for your body and it is a medical emergency. There is no exact threshold that blood sugar needs to surpass to cause diabetic ketoacidosis, but a general rule of hand says it occurs over 250 milligrams per deciliter of blood sugar levels. What's interesting is that it will only occur if the insulin is too little in your body, or say your body is very much resistant to the use of insulin. Then only it can occur. But it is a medical emergency and you need immediate help. You should get hospitalized as soon as possible if it occurs to you. So that is why it is very important for your blood sugar levels to be monitored every day. The characteristic feature of diabetic ketoacidosis that you need to look out for is Kussmaul's breathing or Kussmaul's respiration. It is a set of fast and deep exhalations. Your body is basically trying to compensate for the metabolic acidosis caused by the presence of ketone in your bloodstream. As the ketones are making your body acidic, your body is trying to make it as much less acidic as it can. So how does it do it? Your body keeps on exhaling out excess CO2 in attempt to keep your pH under control. Other than Kussmaul's respiration, what are the other signs that you need to look out for? These are signs such as altered mental state, confusion, polydipsia, polyuria, unintentional weight loss. You need to look out for all these. Confusion or even coma. The diabetic ketoacidosis is known to cause coma if it is left untreated. So it is very important to seek medical help as soon as possible. So let's look at the management of a patient with diabetic ketoacidosis. As soon as he or she is found in this state, he or she is hospitalized immediately. The essential components of treatment are, first of all, we need to correct the dehydration because of excess urination. So IV saline initially to correct dehydration. Once blood glucose level falls to 250 mg per deciliter, then 5% dextrose solution is used to replace the saline. IV infusion of regular insulin administered until ketoacidosis is corrected. Potassium and phosphate are replaced as needed. Sodium bicarbonate is generally not required, however, it is given if blood pH is less than 7. Periodical monitoring of blood glucose, blood gas analysis, serum urea and creatinine is must for such patients.